Let's talk about some of these erection or performance enhancing drugs like Viagra. What's your take on them?
I think you jumped into the treatment of erectile dysfunction, and perhaps one of the things when you're approaching the treatment of erectile dysfunction is the lifestyle issues have to be addressed. Okay, if you're not exercising, start exercising. If you're smoking, stop smoking. If you're taking a lot of alcohol, stop, or perhaps even stop or reduce. If you're overweight, reduce your weight. Okay, if you have psychological issues, see how to address them and perhaps see a counselor. And therefore, once you do that, then you come to the medication, and these are called the first line pro-erectile drugs, and they are used for the non-psychogenic ED. Okay, so if you have a psychological issue, there will be no need of using them, and they do work. And there are several classes of these drugs, and the ones we use are what are called the phosphodiesterase inhibitors. The likes of sildenafil, which is Viagra, or tadalafil, which is marketed as Cialis, or vardenafil, which is marketed as Levitra. We have them here in the market. They are safe if used properly and in the correct dosage. They are also safe if they are used under doctor's prescription, because there's some medication, if you use together with the PDE5 inhibitors, can cause problems with the blood pressure. And most of the catastrophes that have been seen is when you use it with some drugs, especially the nitrites that are used for heart attack and dilating the coronary arteries. You use with them, and then that will lower the blood pressure to a fatal level. And that's the only precaution one needs to take. But they are safe, but they should be used under prescription from a doctor.
Or they should be used under prescription?
Yes.
Okay.
Yes, I think they shouldn't be an off-the-counter drug. Yes. And they are also misused. We have people who use several pills, and they end up with problems like priapism, which is prolonged erection, lasting for over 6 hours. Which is another medical emergency. So that's what we need to watch. Use it in the correct dosage. Tell your doctor what other drugs you're using. And then in the correct dosage, they are helpful. They improve the quality of life. They don't initiate erection. One has to be stimulated. And they have side effects like dizziness, headache, congested nostrils, and sometimes you may get some backache.